Welcome to all our viewers. As we continue to celebrate November as Transgender Awareness Month, we have the privilege today of engaging in a conversation that holds great significance in promoting understanding, empathy, and awareness, particularly when it comes to HIV/AIDS prevention and healthcare. Transgender individuals face unique challenges in various aspects of life, including healthcare, where they may encounter many issues such as discrimination, lack of understanding, or barriers to accessing essential services. So today, like, we aim to shed light on these challenges and discuss ways to foster a more inclusive and supportive environment. To talk more about this, we are joined today by Ms. Rachana Mudraboyina, a member of our Accelerate team, a respected advocate and expert in transgender health. Rachna ji, thank you so much for being with us today. And so, would you like to introduce yourself to our viewers and talk a bit more about yourself?
Yeah, my name is Rachana Mudraboyina. I identify myself as a transgender woman, and I work for the project Accelerate and by RGK, which is funded by USAID and technically supported by John Hopkins University. And my designation in the first transgender clinic myth is like trans health expert. I do normally the networking with the clinic to the other medical expertise outside the clinic for various healthcare services for the trans folks who visit transgender clinic, and also do a larger advocacy with the other stakeholders like government, police, and lawyers, media, and everything to just propagate and sensitize them about trans folks and their health and welfare. Yeah.
Okay, thank you so much. Uh,
Thank
we recognize that transgender individuals face disproportionate risk, especially when it comes to contracting HIV, and hence our conversation today is aimed at amplifying their voices and bringing them to the forefront of discussion surrounding this issue. So now, Rachna ji, could you tell us how you perceive the impact of societal stigma and discrimination on a transgender individual's ability in accessing healthcare services, particularly in the context of HIV/AIDS prevention and care?
Yeah, yes. So the Transgender Remembrance Day and this Transgender Week, which like November 13th to 20th is, we observed in the remembrance of one of the black trans women who have been brutally murdered in US, whose name is Rita Faria, for just being a trans woman herself, trans person herself, which shows immense stigma and discrimination towards the gender variant people. Because the gender is always in a stereotypical way in the society, it's only in male and female always. So there has immense stereotyping of only gender binary, which led to all other people who identify in different genders into darkness and oblivion, where they have to face a lot of human rights violation on a daily basis, actually. And this also have easier the violence on them by the society from the non-trans or non-LGBTQI people,
Mhm.
which has been always underreported. So, taking this as a base, like when we come to the HIV perspective, like the trans and the Hijra community, of mostly in India, have been from ages and ages, have been pushed into the fringes of the society, where they have been also not able to access to the public health system, actually. And that's how they have been often discouraged and not encouraged to take care about their health, and have been institutionalized in such non-caring of the health, which led to a lot of unhealth, and also decreasing the lifespan of trans community and the people of trans community. Also, they have to run from one surgeon to other surgeon, because trans people have a lot of transitional surgeries who undergo gender identity disorder, and very often these systems are not available systematically or scientifically on any of the public health platforms for the trans folks. So there is a lacune, not only a lacune, and also not and very less interest from the Transgender community, working class Transgender community, to access the health system because of this daily, stigma and discriminations, discouragement of not serving them properly with respect and pride when they approach the public health systems, has made them to habituated to the very less and poor health health habits also, interest very less into in self healthcare also. On the other side, it also discouraged a lot the healthcare providers not to get sensitized about trans and hijra folk lives, and how often stigma works on their lives, and how often the healthcare systems prevent them not to serving them only because of the reason of the stigma and discrimination.
Okay, thank you, Rachna ji. Also, talking about the mental health aspect of this, like how accessible and beneficial do you think have support services like counseling and mental health support and other social services have been for transgender individuals so far, especially when it comes to HIV/AIDS?
Yeah, it's very important because the mental health, like when we started this clinic, when we started approaching and referring our trans folks to the mental health experts, what we observed is that there is a long gap of like technical experts on the side of mental health experts also. It's not like using their expertise, but also the first comes stigma and discriminations whether. So, looking into the trans person, the first doubt any such sort of professional get in the society is that whether that trans person is a perfect trans person or a fake one, actually. So there is no term called fake trans person at all. Like nobody can imagine or come out as a trans without their feeling in their heart as a trans or a gender variant person. Nobody forces anybody to be as a trans person to live as a trans person, because it is very tough to be into the like life of trans person and to live as a trans person in society, which is mainly stigmatized on a binary stereotyping of gender actually. So taking that as a base, mental health experts often first doubt about the identity of trans persons, and that's how the counseling and other mental health services has been uh, taken a foot back for like to serving them. So we entered into this gap, and we are able to successfully sensitize the mental health experts that you need to see, though you have the mental health, the whole concept to understand about gender and gender sensitivity and gender diversity, but in implementation, it should be very sensitive to deal with trans folks actually.
Mm.
And we often discuss with them what to do and what needs to be the care taken during counseling and what not to do also. And we always concentrated on the other side, saying that it's not only trans person who should be counseled. The other side, the other stakeholders, the family, the partners, and others, if they are into the college administration, if they're into school administration, all other single stakeholders should be get sensitized on a larger basis. So we extended the scope of counseling by intervening into the healthcare, providers area, and discussing with them how sensitive it should be and how vast it should be, and discussing about various diverse identities within the transgender communities like trans, hijra, kinnar, aravani, shivashakti, transmasculine, trans men, and intersex people who identify themselves as a trans, and all such diverse identities. Yeah.
Okay, that's very informative, Rachna ji. Also, we also talk about PrEP nowadays, right? Pre-exposure prophylaxis, and now that is something which in the Indian context is considerably new. But the Accelerate program has been advocating for the use of PrEP in preventive measures for HIV/AIDS. So, especially when it comes to the transgender community, like, could you like tell our viewers like the importance of PrEP and the adherence to it in preventing HIV/AIDS in the country?
PrEP has been very instrumental in sustaining the loving and relationship and the bond between two individuals, mostly in the trans community. That's what we have observed. we have been successfully able to promote within the working class trans community who have a lot of partners, living with partners. And irrespective of their, HIV status, our trans folks have been regularly taking PrEP. That's one thing to protect themselves from the HIV infection. And also the other side, if they are into the sex work also, there is a lot of enhancement and increase of day-to-day crime with the trans community who are into the sex work mostly, and they may be forced for sex without condom in many times when they are into the sex work, which they cannot resist actually. On those and those circumstances, like the PrEP like always have been a shield to protect themselves from the HIV infections. Actually, these are the only two simple examples, and community have gone beyond this, planning the sex as safer sex using the PrEP. Mostly the transgender community. And we have such case studies and stories which when we started like promoting PrEP in the trans community. Yeah.
Okay. So, like, lastly, when it comes to our conversation today, so especially you being a valued member of our team and also the trans health specialist for Telangana, could you like provide us a bit more insight into like Mitra clinics and the services that they have provided so far, and how that helps? That is basically like, a step towards achieving that goal of, acceptability and empathy and embracing everyone for who they are, especially when it comes to transgender people.
hmm Yeah, that's true. There is a lot of information which has been not floated into the working class transgender community and also the mainstream society about transgender folks and also their health, actually.
Mm.
So this impacts on a larger basis of how the society uh, conceptualize about the whole transgender community and also their health and also welfare actually. So taking HIV/AIDS as a base and looking beyond that and serving the transports on a comprehensive, health project for addressing the health daily to daily health needs of trans folks, often often had also like challenges us to like saying that whether you are promoting these transitional services within non-trans folks also sometimes. And also as I said that there is also mental health experts who doesn't understand, who doesn't come forefront to provide the basic services like gender identity disorder certificates. And there is and the trans community has been into the verge of the poverty all the time actually, because they are out of their homes, they doesn't have any education, they're only dependent either on begging or sex work for their livelihood, and they have to save this money, and they doesn't have any social entitlements like bank account, Aadhaar card, PAN card to save the money also. So these all become the social barriers and also the conceptual barriers like the mental health barrier and are also accessible to the primary healthcare systems. This enhances the risk behavior actually. Risk behavior in the sense of not only HIV, that is there HIV because of very less interest towards self health and self health care also, but also going to the quacks actually for other health needs, not having a proper system to address the comprehensive health needs of trans folks will let them to approach the other systems which can be very dangerous for them and also health risk for them actually, high risk for them. um, the HRT, I feel like the hormonal replacement therapy also, we always do counseling when the transpose comes to the clinic. But if that has not been in a proper way, post and pre, transition, that may lead to a lot of repercussions on the whole health of the trans folks also. And many of the trans folks, before we started these discussions on comprehensive trans health care and also the transition needs of health trans folks, there are no proper channels to the access for HRT and also knowledge about HRT to the trans folks themselves. Many of them have not used post either or pre. which is a need for the bodies of trans folks who want to undergo or who have undergone the transition surgeries to change their bodies actually. So all these are the barriers where like taking HIV/AIDS as a base, we started to go beyond that and addressing those healthcare needs, sensitizing all single healthcare, including physical, including mental health experts across this journey, and making a very smooth way for our trans folks to access those healthcare systems has been the daily to day work of this whole project actually. Yeah.
Okay. So, thank you again, Rachana ji, for taking out some time from your busy schedule and interacting with
Thank
us.
you.
Before concluding this deeply knowledgeable interaction, is there anything that you'd like to say personally, uh, before that a message that you would like to leave the viewers with on like trans awareness and celebrating this month as Trans Awareness Month?
When anybody asks me some message, like I give message thinking in forefront the youth who actually are the coming future of like our country or nation or the nations. I feel like never go with when you're talking and when you're thinking of the gender, never go by stereotyping, binary stereotyping actually, because it can be anyone who can be a trans person or a gender variant person who can be starting from your home also, someone else, like from your home also. So just get acquainted about the knowledge about gender variant people, and just keep away from those myths and misconceptions which always led for stigma, discrimination. And I feel always that learning of these things and also unlearning few other culturally stereotyped in the society about trans folks, which are like myths and misconceptions, will make a future coming generations very healthy and also gender diverse society. Yeah.
Okay, that was really good. Thank you so much. Thank you so much for joining us,
Thank
Rachana ji.
you. Thank you.